Hello everyone, welcome back to my channel. Today I will be dealing with another most important type of cancer, that is breast cancer. Please do like, comment and subscribe to my channel. Anatomy and physiology of breast cancer. The breast is composed of lobes which contain milk producing gland connected by duct that lead to the nipple. Each lobe has several lobules where milk is produced. It has a connective tissue including ligaments and fascia that provide support and structure. Fat tissue surrounds the lobes and ducts, contributing to the breast shape and size. The lymphatic system plays a vital role in draining fluids and fight infection. Lymph nodes located in the armpit and chest are often affected by breast cancer. Then, definition of breast cancer. The breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. Most commonly begin inside the milk duct or milk producing lobules of the breast. Risk factors of breast cancer: family history, gene mutation, late childbearing, early menstruation and late menopause, obesity, alcohol intake, tobacco, hormone replacement therapy after menopause, prolonged use of oral contraceptive, increased breast density. Then pathophysiology. Due to etiological factor, response with carcinogenesis, damage or change in genetic material, hyperplasia, recurrent infection. Then metaplasia, angiogenesis, lymph node swell, nipple invasion, breast cancer. Then type of breast cancer. There are three types of breast cancer. Non-invasive carcinoma, intraductal carcinoma that confines within the large mammary duct. The tumor may vary from small properly defined focus to 3 to 5 cm diameter mass. On cut section, the involved area shows cystically dilated duct containing cheesy necrotic material. It produces a palpable mass in 30 to 75% of cases and presence of nipple discharge in 30% patient. Lobular carcinoma inside. It is not palpable and no visible tumor is identified. It is characterized by filling of terminal ducts or ductless rather uniform cells which are loosely cohesive and have small rounded nuclei with indistinct cytoplasmic material. Invasive carcinoma. Infiltrating duct carcinoma. It is the most histologic pattern that have a hard consistency due to dense collagen stoma. Retraction of the nipple and attachment of the tumor to underlying chest wall may be present. Infiltrating lobular carcinoma. Invasive lobular carcinoma comprises 5% of breast cancer. This specular morphology forms different from other invasive carcinoma in being more frequently bilateral. The appearance varies from well-defined scabies mass to a poorly defined area of induction that may remain undetected by inspection as well as palpation. Colloid carcinoma. This is an uncommon pattern of breast cancer occurring more frequently in older women and is slowly growing. The tumor is soft and gelatinous mass with demarcated borders. Tubular carcinoma. Tubular carcinoma is another uncommon variant of invasive ductal carcinoma which has more favorable prognosis. In inflammatory carcinoma, the term has been used for breast cancer in which there is redness, tenderness, rapid enlargement. Medullary carcinoma, the tumor categorized by large, circumscribed round mass which is typically soft and fleshy or brain-like. Then, Pigot disease of nipple. It is a rare breast malignancy characterized by persistent lesion of the nipple or areola with or without palpable mass. Burning, itching, bloody nipple discharge with superficial erosion with ulceration may be present. These are the different type of breast diseases. Ductal carcinoma inside, then invasive ductal carcinoma, inflammatory breast cancer, lobular carcinoma inside, invasive lobular breast cancer, Pagets disease. Then stages of breast cancer. There are four stages of breast cancer. Stage 1, tumor less than 2 cm, no nodules, no metastasis cancer. Tumor stage 2, tumor 2 to 5 cm with or without ipsilateral nodes, no metastasis. Stage 3, tumor more than 5 cm, positive nodes, no metastasis, and of any of the following: powdery orange, skin or nipple ulceration, inflammatory skin changes in breast. Stage 4, tumor of any size with or without nodes, positive, distant metastasis. Clinical manifestation: masses that are firm, non-tender, irregular, without distant border, no non-movable, skin dimple and nipple retraction cancer, erythema and powdery orange, orange pill-like skin, unilateral nipple discharge, ipsilateral serous all or bloody is suspicious in older women. Enlarged axillary node or supraclavicular lymph node less common. Metastasis of skin is manifested by ulceration and fumigated lesion. This is the lump. There is lump. Then skin dimpling. Then change in skin color or texture. Then change in how the nipple looks like pulling in the nipple. Then clear or bloody fluid leak from the nipple. Diagnostic test. There are different diagnostic tests to diagnose the cancer. First is mammography, a standard X-ray imaging technique used to detect breast cancer early. Annual mammography are recommended for women over 40 years. Ultrasound, a non-invasive image technique using sound waves to create image of the breast tissue. It's often used to further investigation and suspicious area found on mammogram. MRI, magnetic resonance imaging, provide detailed image of the breast tissue and is often used for women with a high risk of breast cancer. Self-exam, regular self-exams can help women become familiar with their breast and notice any change, prompting early detection. Then treatment modality. There are surgical options. Surgical options include lympectomy, mastectomy, and lymph node dissection. Chemotherapy uses medication to destroy cancer cells throughout the body, often used before or after surgery. Radiation therapy. Radiation therapy use high energy rays to kill cancer cells, often used after surgery or for advanced cancer. Hormone therapy. Hormone therapy is used to block the effect of hormones like estrogen, which can fuel breast cancer growth. Medical management. Stage 1, lympectomy plus radiation therapy or mastectomy. In stage 2 cancer, lympectomy plus radiation therapy or mastectomy. In stage 3 may use non-adjuvant chemotherapy to shrink tumor size, may indicate mastectomy over lympectomy. Additional post-operative chemotherapy with or without radiation therapy. Tamoxifen with increased estrogen receptors, stem cell or bone marrow transplant for more than 10 positive nodes. Stage 4, extensive therapy may be limited use, radiation therapy for palliative if no visceral disease. Then surgical management, lympectomy. This procedure involves the removal of the cancerous mass and some normal tissue for a clean margin. Quadrantectomy. This procedure involves the quadrant of the breast in which cancer is located. A greater portion of normal tissue surrounding the cancer is removed with some of the overlying skin and underlying muscular fascia to provide a wide margin of cancer-free tissue. Modified radical mastectomy. This procedure involves the entire removal of breast, axillary lymph nodes, and overlying skin. This is the most commonly performed mastectomy. Then axillary node dissection. This is a procedure involve ipsilateral lymph node. It is part of lymphadenectomy modification radical mastectomy. Standard radical mastectomy axillary dissection is not usually done to treat the diseases, but the determinal the disease stage and need for chemotherapy, locally advanced or inflammatory breast cancer. Stage 3. Total or simple mastectomy. A simple mastectomy is a surgical procedure that involves removing the entire breast, including the breast tissue, nipple, and areola, but not the lymph node or muscle beneath the breast. This procedure is typically performed as a treatment for breast cancer or as a preventive measure for individuals at high risk of developing breast cancer. Then sixth is standard radical mastectomy, and seventh is extended radical mastectomy. Radiation therapy use high energy rays to damage and destroy the cancer cells. Chemotherapy uses drug to kill the cancer cell, often administered intravenously or orally. Breast reconstruction. It is the option for women who have done mastectomy. It can be done by using tissue expansion, breast implant, latissimus dorsi muscle flap, transverse transverse rectus abdominis muscle flap, or gluteal maximus muscle flap. A woman may delay reconstruction until chemotherapy or radiation therapy is completely, or she may choose immediate reconstruction to be done at the same time as the mastectomy. Nursing management assess pain and discomfort of the patient, administer analgesic to promote optimum pain relief, provide non-pharmacological pain management, educate patient about the side effect and treatment, promote decision making ability, reduce fears and anxiety. Health education, hand and arm care of after axillary lymph node dissection, avoid blood pressure, injection, blood draw in affected extremity, use sunscreen, inspect repellent to avoid bite, insect repellent to avoid bite, wear gloves for gardening, use cooking mittens for removing object from oven, avoid cutting cuticles, put them back during manicure. Use, use electrical razor to shave armpit, avoid lifting object. Then, if trauma cut was wash with soap, water, and apply OTC or antiseptic ointment. Observe area and extremity for 24 hours. If redness, swelling, fever, chill occur. Incision site care. Bath and wash incision and drain site with soap and water. Dry dressing 7 days after 4 to 6 weeks of healing. Lotion cream apply. For continuing care, pain management adherence to exercise pain. Follow up in 3 to 6 months. Then exercise increases circular muscle strength, prevent joint stiffness, contractures, restore full ROM. 3 days for 20 minutes for 4 to 6 weeks. Analgesic warm shower prior. Normal household activity, brisk walking, exercise, cycling, stretching, driving one, drain removed, gradual introduction of previous activity. Nursing diagnosis, deficit knowledge related to surgery and treatment. Then anxiety related to disease condition, disturbed sensory perception related to nerve irritability in affected arm, breast and chest wall. Disturbed body image related to loss or alteration of breast, self-care deficit related to partial immobility of upper extremity on operative side. Prevention of breast cancer. Get screened for cancer regularly, control weight and do regular exercise. Then know your family history of breast cancer, limit the amount of alcohol, avoid induced abortion, then avoid unnecessary medical radiation exposure, consume food rich in calcium and vitamin D, eat omega 3 fatty acid, soya product. Then caution, prevention of change in bowel or bladder habit, A sore that does not heal. U. Unusual bleeding or discharge. T. Thickening of lump in breast or elsewhere. I. Indigestion or difficulty swallowing. Then O. Obvious change in water moles. A. Nagging cough or persistent hoarseness. U. Unexplained weight loss. P. Pernicious anemia. Thank you everyone. Hope you understand the video. If you didn't understand anything, then please do comment. And if you like the video, please like, share, subscribe to my channel. Thank you.